Let me start with a moment I see far too often. A patient sits across from me, cuff tightening around their arm. They're quiet, polite, smiling a little, but I can see it, the shallow breathing, the tense shoulders, the slight tremor in their hands. The numbers appear on the screen, and immediately there's fear in their eyes. Too high, again. And that's when I usually say something that surprises them. Before we talk about changing medications, let's slow your breathing, because what most people don't realize, what almost no one has ever explained to them, is that one of the fastest, most powerful ways to lower blood pressure isn't in a pill bottle. It's something you've had since the moment you were born: your breath. In the next few minutes, I'm going to show you 3 specific breathing techniques that can lower blood pressure in real time, often within 1 to 2 minutes. Not hours, not weeks, minutes. And I'm not just going to explain them. I'm going to guide you through them second by second so you can actually feel the change happening in your body as you watch this. I've spent decades watching blood pressure numbers rise and fall. I've seen people placed on a second medication, then a third, sometimes even a fourth, while no one ever taught them how to use their own nervous system to their advantage. And I've also watched something else happen. I've watched systolic blood pressure drop 15, sometimes 20 points in a matter of minutes, simply by changing the way someone breathes. This isn't relaxation talk. This is physiology. Your breath directly controls your nervous system. When breathing is fast and shallow, your body interprets that as danger. Stress hormones rise, blood vessels tighten, pressure goes up. But when breathing slows and deepens, the opposite happens. The nervous system shifts into a calm, restorative state. Blood vessels relax. The heart doesn't have to work as hard. Blood pressure drops immediately. This isn't advertised. There's no commercial for it, no profit in teaching someone to breathe better. But the research is overwhelming. Study after study shows that slow, controlled breathing can reduce systolic blood pressure by an average of 10 to 15 points, which is comparable to adding another blood pressure medication. Except this costs nothing, has no side effects, and puts the control back in your hands. By the end of this video, you'll know exactly when and how to use each of these 3 techniques, whether it's daily training, calming anxiety, or handling a sudden spike. You'll have a tool you can use anywhere, anytime. Let's begin. The first technique is one I teach most often because it's simple, powerful, and works quickly. It's called 4-7-8 breathing. Here's why it works. The long, slow exhale activates the parasympathetic nervous system, what we call the rest and digest system. This is the system that tells your blood vessels to open, your heart rate to slow, and your blood pressure to come down. I remember a man in his early 70s whose blood pressure would spike whenever he felt stressed. Traffic, arguments, even watching the news. His readings would shoot up into dangerous territory despite medication. We didn't change his prescription. We changed his breathing. Within 2 minutes of practicing this technique, his pressure dropped more than 20 points. Not perfect, but dramatically safer. Over time, his baseline improved. Fewer spikes. Less medication needed. All from breathing. Now we're going to do this together. Sit comfortably, upright but relaxed. Place one hand on your belly. When you breathe in, that hand should rise. That tells you you're breathing deeply enough. If you have a blood pressure monitor nearby, pause the video and check your pressure now. Write it down. This is your baseline. When you're ready, empty your lungs completely through your mouth. Let it all go. Now close your mouth and breathe in through your nose for 4 seconds. 1, 2, 3, 4. Hold your breath gently, not forcefully, for 7 seconds. 1, 2, 3, 4, 5, 6, 7. Now exhale slowly through your mouth for 8 seconds. 1, 2, 3, 4, 5, 6, 7, 8. That's 1 cycle. We're going to do 3 more. Inhale through your nose. 1, 2, 3, 4. Hold. 1, 2, 3, 4, 5, 6, 7. Exhale slowly. 1, 2, 3, 4, 5, 6, 7, 8. Again. Inhale. 1, 2, 3, 4. Hold. 1, 2, 3, 4, 5, 6, 7. Exhale. 1, 2, 3, 4, 5, 6, 7, 8. Last one. Inhale. 1, 2, 3, 4. Hold. 1, 2, 3, 4, 5, 6, 7. Slow exhale. 1, 2, 3, 4, 5, 6, 7, 8. Notice what's happening now. The heart rate slows, shoulders drop, the body softens. If you checked your blood pressure earlier, check it again. Many people see a 5 to 10 point drop after just 4 cycles. Practiced 4 times a day, morning, midday, evening, and before bed. This technique trains your nervous system to stay calmer even when you're not thinking about it. Now let's move to the second technique. Resonant breathing. This one is even simpler and incredibly effective for long-term control. You breathe in for 5 seconds and out for 5 seconds. No holding, just smooth, steady breathing. That's 6 breaths per minute, the optimal rhythm for balancing the nervous system and lowering blood pressure. I once worked with a woman who dreaded doctor visits because her pressure would skyrocket the moment she walked into the clinic. At home, her readings were fine. Anxiety alone was driving the numbers up. She practiced this breathing for 5 minutes in the waiting room. That day, her blood pressure was the lowest it had ever been in a medical setting. Here's why this works. At this pace, your heart rate variability synchronizes with your breathing. Stress hormones fall. Blood vessels relax. The cardiovascular system enters a state of coherence. Let's practice. Hands on your belly. Breathe in through your nose for 5 seconds. 1, 2, 3, 4, 5. Breathe out through your nose for 5 seconds. 1, 2, 3, 4, 5. Again. In. 1, 2, 3, 4, 5. Out. 1, 2, 3, 4, 5. Continue at this gentle pace. No forcing, just steady rhythm. This is the kind of breathing you can do anywhere. Driving, watching TV, sitting in a waiting room. No one even knows you're doing it. Practiced for 5 to 10 minutes twice a day, this becomes your maintenance technique. Over weeks, it lowers average blood pressure significantly. Now, the third technique, the one I teach for emergencies. This is alternate nostril breathing. When blood pressure spikes suddenly, when panic sets in, when the heart races, this is the fastest way to regain control. It's been used for thousands of years, and modern research confirms its effects. It balances the nervous system and forces slow, deep breathing almost instantly. Here's how it works. Raise your right hand. Use your thumb to close your right nostril and your ring finger to close your left. The other fingers can rest comfortably. Close the right nostril. Breathe in through the left for 4 seconds. 1, 2, 3, 4. Close the left nostril. Open the right. Breathe out. 1, 2, 3, 4. Breathe in through the right. 1, 2, 3, 4. Close the right. Open the left. Breathe out. 1, 2, 3, 4. That's 1 cycle. We'll do 3 more together. As you practice this, notice how quickly the body settles. The racing thoughts slow. The pressure eases. This is your rescue technique. 5 minutes can make a dramatic difference. Now here's how to use these strategically. Use the 4 to 7 rate, breathing 4 times daily to train your nervous system. Use resonant breathing for longer sessions to maintain balance. Use alternate nostril breathing whenever pressure spikes or anxiety hits. I've watched people combine these and transform their numbers without adding medications. The key is consistency. Just like medication, this works best when done daily. Always coordinate with your healthcare provider. Never stop medications abruptly. But many people find that with time, fewer medications are needed. Your breath is your most powerful blood pressure tool, free. Always available, proven by research, controlled by you. And now, you know how to use it. Practice it, trust it, share it, and take control of your health, one breath at a time.